right, you're on the record now. Dr. Vinil and Dr. Mona Sidhpura, thank you so much for joining us on ITV Gold from Georgia. I hope you're doing well. How's it going?
We are doing well. Thank you for having us.
Yeah, thank you so much.
Of course. Just starting off this interview, I kind of wanted to reflect on some numbers that are coming in just today when we're talking about COVID-19 cases and deaths. We're looking at about 1.3 million cases in the United States, and we're looking at over 80,000 deaths. And this is happening today. And also world count, we're looking at 4.1 million cases and 286,000 deaths. When we're looking at these numbers, could you explain to us how we should process them and perhaps understand what it means when we're looking at the bigger population?
Right. So the 1.3 million cases, at least in the US, I think that's a good reflection of the amount of testing and the availability that we have that we're picking up these cases. I think the number that we really need to focus on is the 80,000 in deaths. That's the one that's a bit alarming, especially, in the beginning when this all started, we were thinking as the weather would warm up that a lot of this would start to flatten, just like the flu does. But the fact that we're still seeing a rise in deaths, complications, things like that, that's what I really focus on. And that's what I think that's very alarming. With all of this, as long as that number is on the rise, I think we can't let our guard down at all.
And I think specifically, especially in Georgia, the number of cases and deaths has definitely been increasing. I know the curve is not accurate. It shows that it's sort of flattening, but I don't think it's accurate. However, in Georgia with the reopening, I think that we've definitely seen a lot more cases in our hospital with the availability of testing. We've been able to test with the rapid testing much more frequently, and we've noticed that a lot more patients are becoming more positive, and then we've also had a tremendous more deaths in our hospital as well. So Georgia's reopening has definitely caused an increase in COVID patients and deaths as well.
And I want to discuss this reopening because just this past weekend, over 1,000 new cases were reported in Georgia. And Georgia was doing relatively okay in comparison to, a state like here, New York State, where, we're seeing the most number of cases. Do you think this reopening now really sort of is a huge concern for medical professionals such as yourself? And do you see a huge rise in cases because of this reopening?
I would say absolutely. The funny part about the whole thing was that the shelter-in-place order was in place until April 30th. Yet 6 days before that, on the Friday before that, April 24th, we started letting up. The governor said, "Okay, we're going to open up hair salons. We're going to open up bowling alleys. We're going to open up, even different businesses, restaurants." But the shelter-in-place was still, it was still there. And that didn't make sense because it was very contradictory. And I think as a consequence of that, I think people are starting to think, oh, as we're opening this up, hey, it looks like we're starting to flatten. It looks like things are good. We can sort of let our guard up, and continue doing what we're doing. And that's concerning. And I somebody asked me in the hospital the other day, do you expect a surge over the summer, or do you think it's going to be in the winter? And I, before this happened, before we reopened things, I would have said, I think we would be good over the summer. And I think maybe as the winter, and the fall kind of set in, I think we'd have to sort of reevaluate. But now I think it's really up in the air. I wouldn't be surprised to see another surge, at least over the summer.
Oh, wow.
Yeah.
Do you also agree with him?
Yeah, I think that especially in Georgia, I don't know. I think with the governor giving this type of hope to people and thinking that, we're in the right direction as far as having control of the whole situation, I think people are really taking this kind of laxative. They're not. Some people are not wearing masks. Some people are thinking that this is not even, this is a conspiracy. I think in Georgia, it is just a very different dynamic of people where we've noticed that even when we go to places like Home Depot or anywhere, some people are not taking the right precautions. And I think that comes with a lot of the states being loose on their restrictions. So I think that the fact that Georgia's reopening is setting an example for the whole entire country. And I think that it's dangerous because now people are not taking it as seriously, and that's going to be a problem. I think the numbers are going to spike. I think that the hospitals are going to basically not going to be able to handle a lot of this because it's now that everyone's just walking around going about their normacy. I think we're going to see a significant amount of increase in patients. Absolutely.
Yeah.
As medical professionals, what are your biggest concerns right now while the state is reopening? And as you said, there are so many areas that are reopening where you're going to have a person-to-person contact. What is your take on that?
I think from my standpoint, as medical professionals, that we're worried that the young individuals or the individuals that are not showing any symptoms are going to they might still have it or might have been exposed to it, and they're going to go about the community and potentially spread it to the individuals that are more vulnerable. And those are the vulnerable patients that are going to come into the hospital, and they're going to be the ones that are going to become more sick and could potentially lead to death.
Right.
And that's what I think this whole entire COVID disease and infection is worrisome, is that a lot of people think that they don't have symptoms, so they don't have to wear masks, and they spread it to their grandmothers or the patients that are actually have other comorbidities. And those are the patients that end up in our hospital, in the ICU, on a ventilator, and those are the ones that we are more worried about.
Mm-hmm.
Could you describe perhaps a picture of COVID floors right now in your hospitals? What is happening in terms of PPE supplies, in terms of critical care and patient, taking care of patients? How have the dynamics changed?
I would kind of explain it like a very large dichotomy. We had, there's a medical floor, and then there's an ICU, and then a step-down unit. The medical floor had, we have like an area of the medical floor that's sort of quarantined off for the COVID patients that are completely stable. Some of them are requiring some supplemental oxygen, some aren't, some are completely asymptomatic, but they tested positive, and we're kind of waiting on them to test negative before getting them to a nursing home or whatnot, but completely stable. And then we have the ICU that patients are in ARDS, that's adult respiratory distress syndrome, and they're on a ventilator, and they've been on a ventilator for several days. And we actually have had several deaths over the last week. In regards to PPE, I don't think that, any of that has changed at all. I think the only thing that's changed is that we've received a lot of donations. I don't think we're in any sort of shortage or whatnot. But when it comes down to, who to sort of gown up for, who to wear a mask for, a lot of us are now just wearing an N95, gowning up for most every patient we see, COVID positive or not, because just, there's a high false negative in the testing as well. So we're just kind of protecting ourselves, and just when we go to room, we're just making sure that we're not spreading this at all. And that's just been a sort of a challenge. But I think if you're all or nothing about it, I think you'll be fine.
Yeah, I think everyone, every nurse, every respiratory therapist, every tech, every doctor, everyone is gowning up and wearing the appropriate PPE, even if they're COVID positive or not. At this point, the amount of patients in the hospital that are positive are so significant that the ones that are not, it's almost as if they might be false negative. So our medical floor used to be completely, it didn't have any COVID patients. We used to have only COVID patients in the ICU or the step-down unit. Now, within the last 2 weeks, they're everywhere. Our whole medical floor has all COVID patients. Our whole ICU has COVID patients. The PCU has COVID patients. I think the amount of testing that's been available has been much more significant in Georgia. So we've had the capability of do rapid testing. So patients are becoming more are positive faster in Georgia. So I think that's a reason why we're getting more cases, is this, that we're knowing that they're positive earlier on.
Right. And I think it's kind of getting normalized, to be honest with you.
It's everywhere.
Yeah.
In our hospital and most hospitals here.
You both highlighted testing, so let's just have a discussion about that. There is the rapid testing, there's the antibody testing, and there are various other tests that they're trying to figure out to see if someone has immunity or if they can have less, of false negative or false positive results. Could you sort of describe what is happening at least at your hospital in terms of testing, and your take on how important testing is going to be for us right now?
We definitely were struggling with the rapid testing. Early in April, they were all send outs from the hospital, and it would take almost a week to come back. Now I think we're kind of getting pretty. I guess it's a smooth transition. We're getting more and more availability with the rapid testing. Comes back within 45 minutes to an hour. That again, I'm kind of backtracking back to what I said earlier. I had a 29-year-old patient the other day that sort of checked all the boxes for, having COVID-19, healthy male, and had the chest x-ray findings, the fever, the cough, shortness of breath. We did a rapid test on him and it came back negative. I still gloved, gowned up, wore an N95, walked in there and said, hey, you definitely have COVID-19. You're stable enough to be discharged from the hospital, but you still have to quarantine. But the availability of the testing is, there's no issue there. We definitely have, we're pretty plentiful with that. I wouldn't say that there's any issue there. And then as far as the antibody testing, I'm not sure that we're using that as much because it's not really indicative of the acuity of the disease. I think that's one thing we're trying to pick up, because you could have had that months ago, been tested positive, developed antibodies, and then now, you could be in the hospital for something else, and then you check the antibodies and it's, sort of, you may have developed an immunity at that point. But I think we're kind of more focusing on the rapid testing, the PCR, and trying to pinpoint those patients so we can sort of triage them appropriately.
Yeah, I agree. I don't think I know in some hospitals in New York, they've already been using the antibody testing. I know in Georgia, we're still maybe a little bit behind because we just got the rapid testing a few weeks ago. So I think Georgia's just trying to catch up to the north, that's for sure.
When should a patient, go for this testing, or when should they approach somebody about getting tested?
I've been telling, that's actually a question we've received a lot, even from just family and friends. A lot of times, depending on, your comorbidities, if you have heart disease, chronic lung disease, anything like that, it really depends on what's really going to bring you into the hospital. I know there's a lot of drive-through testing and whatnot. I don't really have any specific guidelines. I mean, if you feel like you're running a fever, you have a cough, you feel you feel kind of weak, lethargic, but you're not having difficulty breathing or having severe chest pain or anything like that, stay at home, quarantine. I would really treat that as if you have the infection. Quarantine from family, any friends, treat it as if you have the infection. It's really when you develop, oh man, I really can't catch my breath. Whenever I take a deep breath, I have severe pain in my chest. I can't even get up out of bed, where you really feel severe, just like similar to the flu type symptoms where they really push you over the edge. It's when you get to the hospital, and that's when you get tested. That's what I would probably say is, either stay home or go to the hospital. But, with the clinics open, I think a lot of people are testing that way just to, get that positive and sort of further give you guidelines from there. But I've been telling people, just act like you have the virus when you're getting those typical symptoms.
It's a smart point. Act like you have a virus so that you can at least make sure that, you're taking care of it. My question to you in that terms would be the treatments and the drug trials we keep on hearing about. They have experimented with a few antiviral drugs now. The vaccination, they're saying that they're hopeful something could come up by the fall or maybe next year. Could you give us an insight into your own experience with some of these drugs that we're hearing in the market?
Mm-hmm.
Yeah, I mean, I think as far as in Georgia and our hospital, I don't even think we've even come that far to use some of these drugs. Besides, we're still using azithromycin and Plaquenil. And even then, those medications are still limited. So the other medications that are being tested right now for trials, I don't even think they're available in our hospital right now. So we're still kind of behind, I would think, compared to a lot of the other hospitals as far as the availability of that medication.
Right,
Absolutely.
right. And I know remdesivir has been in the news recently for, it's a lot of, 31%, recovery rate, positive recovery rate in patients compared to a placebo, not taking anything. But the federal, the government's sending a lot of that to the tri-state area, New York, New Jersey, the places hit hardest, and rightfully so. Those cases are exponentially on the rise. So that hasn't hit our hospital, so we don't really have any experience, using that drug. But I would say a lot of this is timing. Just like with the flu, you take Tamiflu within 48 to 72 hours of symptom onset. I think if you take any of these drugs early enough, I think you'd really see some sort of positive impact. But that's sort of the issue with COVID-19 is, well, when do you know you really had it? I mean, you could have been asymptomatic for 3-4 days, and then the symptoms started, and then they really progressed. And we're just seeing a lot of variability in that. Some people tested positive a month ago. They were in the hospital, they were stable. We sent them back home, and then they come back a week later, just deathly ill, and then they placed on a ventilator. It's really tough to gauge that. And I think that's kind of one of our biggest challenges right now.
So do you think at this point then a lot of this hope and a lot of what will happen kind of then relies on vaccination? Is that what we all have to in the end basically wait on?
I think for the whole society to feel comfortable to be able to go about their normacy, I think it's going to be on vaccination. I think no one is going to be able to do what they used to do without knowing that they're protected. So I don't know when the vaccine is going to be available. I don't know if I know they're going to decide the priority of who should get the vaccine. I don't know if it's going to be this fall or next year. It's just, or if they're even going to get a vaccine. That's another question too. So I think for everyone to feel comfortable to be able to go about their lives and do what they used to do, I think a vaccine is definitely going to be something that's really important.
Right. I would say the rest of 2020 is really just up in the air. I can say with certainty we're obviously not going to get a vaccine this year. It's going to probably be next year sometime if they're able to develop it. But we're going to be wearing masks out in public. We're going to be washing our hands continuously. We're going to practice social distancing for quite some time. I don't know that we're going to have large bodies of group able to kind of convene together anytime soon. And I know that professional sports are debating this right now. When are we going to start? Is the NBA going to start back? Is NFL going to start back on time? A lot of this stuff is going to be without fans in the audience, and it may not be till next year with possibly a vaccine that we can see some sort of normalcy again.
Another important question that's been coming a lot to us here is from patients that are South Asian and are at high risk. The high-risk patients that we're talking about have heart diseases, they have chronic illnesses, they have lung diseases. We're talking about high cholesterol, blood pressure, and so much more. Our South Asian population is currently concerned about, COVID interactions with any of these diseases. Have you found any of those interactions yet? And if there's any advice you can give to these at high-risk patients, what would you say?
We've definitely found a strong correlation with the chronically ill, especially over the age of 60 to 65. I mean, those are the ones that are prone to getting into ARDS and on a ventilator in the ICU. But you do see those isolated cases with men and women in their 20s or 30s that are getting severely ill, and they never have been hospitalized. They don't have any chronic conditions. But I would say it definitely skews more towards the chronically ill patients. The one thing I would say that's at least a good thing in Georgia, that the shelter in place doesn't apply to the general population of healthy individuals, but it's still in place, I think, at least till June 12th for the chronically ill and the elderly patients, which I am fully a supporter of. I think if you absolutely need to leave the house, be cautious, but shelter in place, above the age of 60 to 65, chronically ill, because you're definitely the most susceptible to this virus.
In terms of discussing your personal experience on the front line here, we're calling everyone here that's, a healthcare professional, a healthcare hero, because of all of the service you are doing for the community here. I want to kind of get an insight into how this has personally impacted both of you. You're both married, and you're both currently, on the front line. You have children. How, has this sort of changed your life? And also, what do you have to say about the resilience you've seen in the entire medical community during this pandemic?
Yeah, I think that's definitely it's been an experience for the both of us. We have 2 young children, and we both are every day we've seen probably 10 to 15 COVID positive patients each, and we come home, and the first thing we do is run to the shower. I can't even touch my children until I take a shower and clean, and then we pick our children up from my mom's house. So and my grandmother's with her. So it's just been really difficult on a daily basis to continue to work, come home, and that fear that we're going to spread it to our children and to my mother and my grandmother. So that's been really difficult. And I think that one of the greatest things about all of this is that, yeah, as physicians, we're on the front line, but I would give a lot of credit to the nurses. I think the nurses are the ones that are seeing the patient at least 5 times probably a day. So they're going in and out. They're putting their lives on the line multiple times a day. And I think the nurses deserve a lot of credit. I think it's really difficult, and they have families and they have children as well.
Yeah, for sure.
Mm-hmm.
How's your experience been?
Just to add what she said, with daycares closing, her parents have had to really, step up and take care of our children, week on, week, every week. And that's what kind of created some anxiety. In the beginning, it was pretty scary for us. We didn't know exactly what this virus, probably in the mid-March, end of March, we didn't know exactly what to expect. It seemed to be spreading really fast, exponentially. To be very transparent, I thought both of us were just going to get it. And then we thought, what are we going to do if we're having a fever, cough? We're going to have these symptoms, and we couldn't go to work, but then we couldn't take care of our own children. So it's just something that is constantly weighing on our minds every single day. And then when we're feeling fine, it's just that we've been around a lot of these patients, and they're like, oh, are we asymptomatic carriers? When we go see, her grandmother lives with her parents as well. She's in her 80s. She has some chronic conditions. Are we going to spread it with her? So we just are getting accustomed to this life where we pick up our kids from her parents. We're wearing these surgical masks. We're distancing from them. It's just something that's been kind of tough to sort of become accustomed to. This is just sort of day-to-day life, at least indefinitely right now. But I think as time goes by, and then everybody's healthy for now, but we just have to keep that up, and that's what we have to kind of frame our mindset at this point.
Definitely. What's the message you both would like to give to your fellow healthcare workers, the doctors, nurses, everyone that's on the front line?
Just keep doing what you're doing. I mean, come to work. I mean, a lot of us, to be honest with you, everybody says that they're all like healthcare heroes. This is just another day for us. We've never experienced a pandemic like this. I don't know that we'll ever experience this again, but it's just waking up, kissing our loved ones, going to work, gowning up, seeing patients, talking to families. That's just what we do. I think it's just sort of another day in the life of what we do. And we have to give our staff, our nurses, and even the janitorial staff, people that work in the cafeterias, people that, may not be as accustomed to dealing with any of this. Just, it's just how it's a new norm. Definitely. And we're ready to kind of take it on.
Yeah, and that you're not alone. We're all in this together.
Well, yeah, that's true. We are all in this together. We're almost coming towards the end of this interview. My question to you here would be kind of going back into the medical questions. What is both of your focus for the next 2.5 weeks to 3 weeks while Georgia reopens? Parts of the nation, even here, parts of New York State will also reopen by the end of this week. What is your focus right now? What are some things that you have to watch out for to ensure better public safety and better health for all?
I think that at least for people in Georgia, as restaurants start to reopen, as certain hair salons and bowling alleys, I think one of the main things that we need to make sure everyone is doing is to still wearing a mask and still washing their hands, still protecting themselves, even if they don't have symptoms, even if they feel fine. Because I think that's the problem is that people think that they're okay and they don't have to protect themselves. But I think in general, everyone needs to wear a mask, wash their hands, and for the safety of their community, not just themselves.
Yes, for sure. What about you, Dr. Vinil?
Yeah, I mean, I have to definitely second what Mona said. I mean, just the fact that we're lifting this shelter in place, we're opening up businesses again, and just mind you, a lot of these businesses are taking in their own hands to say, well, I'm going to open up my business when I feel safe enough to open it, and then when I do, I'm going to make sure everybody that walks in here wears a surgical mask, wears gloves, and practices the 6 feet social distancing. That's really the greatest concern right now is let's limit the number of people, 10 or less. Let's continue to social distance and see this out, and I think we'll be okay. I think there's still a lot of anxiety out there, and rightfully so. I think we just need to keep our guard up until we sort of can establish a hold on this.
My one last question for the both of you is going to be mental health and its wellness has become a huge, matter of concern and something that everyone is advocating for. What do you both have to say, and perhaps some tips you can give for our audience right now to just be, more well and more healthy through this pandemic?
Right. The best thing I could say is it's okay to see people. We hadn't seen, my parents. They live 2 hours away from us. We just saw them last weekend for the first time in probably since January before all this had even started. But, they were concerned. They're both above the age of 60. But, I told them we can still see each other. You can see the kids. We'll all be wearing surgical masks. We'll sit, the certain distance away, but it's okay to still see people and go on walks. The weather's getting nicer this time of year. It's definitely something that's going to, be good. It's kind of peaceful for the mind to know that it's you don't have to be locked up inside your house for the rest of the year. But you just have to be mindful that this is going to go on for some time. But it's not wrong to be around some of your loved ones.
Right. Great point, Dr. Mona.
Same thing. I think this is a great effort. The weather's great. I think going for walks, getting some fresh air. Eating healthy, getting some rest is always going to help as far as just getting your right mind on set.